Welcome to AHEAD Simulations, Learning Clinical Otoscopy with Carl. Welcome to the Carl community. We're happy you could join us. In this lesson, you will need a Carl ears, an otoscope, and different size specula. Step 1. Obtain consent by explaining the procedure. For example, I would like to do a simple examination of your ears using this light. I will be checking the health of your ears and if there's any earwax. Do you have any questions? Step 2. Choose the proper speculum size. Select the largest speculum that will fit comfortably in your client's ear. Step 3. Hold the otoscope with the same hand as the ear you are assessing. For an adult, with your free hand, gently pull the pinna up and back to straighten the canal. Step 4. Using the same hand that is holding the otoscope, brace 1 or 2 fingers against the jawline in case of sudden movements. Step 5. Gently move the otoscope into the proper position to view the ear canal and tympanic membrane. This is video otoscopy of a translucent Carl ear canal. Notice in this video the small, gentle movements of the otoscope. This video demonstrates an otoscopic examination with too much movement and force. Step 6. Now, examine the other ear. When switching ears, make sure to use the opposite hand. You did it. Now keep practicing your technique. Some of the skills obtained from this lesson are proper otoscope grip and maneuvering, inserting the otoscope gently, and using bracing techniques. Thanks for joining us. For more information, go to aheadsimulations.com.